Hello, this is Dr. David Greene, CEO of the Florida Pain Network. Today's topic is my hip pain coming from a hip or lumbar spine problem? Millions of Americans suffer from hip arthritis, and it can lead to a tough time walking, exercising, significant disability. About 300,000 total hip replacements are performed every year in the U.S., and this number continues to go up. When pain is occurring in the hip area, it just seems obvious to assume that the problem is actually occurring in the joint itself. But it may or may not be coming from the hip joint. There may be an overlap in symptoms between hip arthritis and what's called lumbar spinal stenosis. As individuals age, spinal stenosis is very common, just like hip arthritis. Both occur from degeneration. So here's a cartoon picture of lumbar spinal stenosis. It starts with degeneration of the intervertebral disc. This then shifts extra forces back to this area where you have the joints of the spine. They can get arthritic and enlarged, and the soft tissue around it can get enlarged. And that can impinge on the spinal canal and the nerve roots as they try and get out from the spinal canal. Okay? The hip pain that it develops from it can mimic that seen with hip arthritis pain. So how do you differentiate between the two? First of all, here's an MRI showing significant disc bulging going back, and then significant overgrowth of the joints of the back of the spine. You see how much it pinches in the canal here? There's a cartoon of it. It can really pinch a lot from the arthritis. And here is an arthritic hip on x-ray. You see how there's really minimal joint space, and here there's excellent joint space. This is a normal looking hip, and here you have cysts and hardening of the bone, very significant arthritis. So this may have a lot of pain or it may have minimal pain. So how do you differentiate between this? Well, first of all, history, area of pain, whether it's in the hip itself, in the thigh, or the buttock, duration, when does it come, when does it go? Hip and spine source can cause referred pain that goes down the leg. Okay, so spinal stenosis can cause pain that goes down the thigh, and hip arthritis can cause pain that goes down the thigh. Physical examination. If you have significant point tenderness over the hip, that's more indicative of hip arthritis. If you have range of motion pain of the hip, that's more indicative of hip arthritis. Neurologic exam, not very helpful. Imaging studies can be helpful, but as mentioned before, you may have very significant arthritis, such as you can see here, triangular spinal canal, thickened soft tissue and degenerative lumbar spinal joint arthritis. This may have no pain whatsoever, okay? So injections are really what can help delineate between where the pain is coming from. So if you have hip arthritis and you have a hip injection of numbing medicine into that arthritic joint and the pain goes away within a few minutes, you can pretty much reasonably say that that's the issue, okay? Then with epidural injections, typically if you're having lumbar spinal stenosis leading to hip pain, you'll get a lot of relief with that injection. So here's the way the outcomes work. If you get complete hip relief with a hip injection, you have a hip problem. If you get complete hip relief with an epidural injection, it's a lumbar issue. If you get some relief from a hip injection and the rest of the relief comes with an epidural, it's a combination of the two. There's always the possibility that neither injection will work well. In that case, further investigation is necessary. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances and providing over 25 treatment options in the network with the board-certified award-winning doctors. In the Tampa area, visit us at painmanagementttampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Greene with the Florida Pain Network. Your pain stops here.